By far the largest, most frequent cause for miscarriages are chromosomal abnormalities, meaning that the egg is chromosomally abnormal. That leads to a chromosomally abnormal embryo. And this is a random event. It's bad luck, and we don't want to treat it, separate from the fact that we have no treatment to fix a chromosomally abnormal embryo. But roughly 15% of miscarriages, and the number is bigger in repeat miscarriages. The more repeat miscarriages there have been, the higher the risk that it is not a chromosomal event, are medical complications in the mother. So for example, diabetes, if poorly controlled, is associated with a very high miscarriage risk. Autoimmune diseases are associated with a high miscarriage risk. And there are obviously other less frequent causes. But the important principal point is that chromosomal abnormalities are the vast majority of cases, but the more miscarriages a woman experiences and the later the miscarriages occur, the more one has to think about other possible causes as well, because chromosomal abnormalities usually are miscarried relatively early, in other words, before fetal heart. So if a woman experiences later miscarriages after fetal heart, we don't want to treat abnormal embryos. But if the underlying problem is a medical problem, then obviously the treatment means treating the underlying medical problem. So for example, in our infertility practice, if a woman is a diabetic, we will pre-treat her. We will not start fertility treatment. We do not want her to even try to get pregnant until her blood glucose levels are well controlled, because that will not only increase her miscarriage risk, but will also increase her risk for birth defects. So we will start trying to get her pregnant only after we have achieved good blood sugar control. If the underlying cause is immunological, we will try to suppress immune system hyperactivity, etc., etc. In other words, the treatment always is geared at the underlying condition, trying to normalize it as much as possible before the patient even gets pregnant.